Hello, my name is Allison. I'm going to be your nurse today. Can I have you state your full name and date of birth, please?
Carlos Obando, July 1st, 1998.
Okay. I'm also going to move the bed to my working level, and then also provide privacy, so put a curtain or something. And also, so today I'm going to be doing a head-to-toe assessment. I'm going to be touching you in different parts of your body. Is that okay?
Yeah.
Okay, can you sit up for me, please? Just slowly at the edge of the bed. Thank you. And so on inspection, I see that the head is round, it is sitting upright, it is normocephalic, and also it is symmetrical bilaterally. I'm gonna palpate the scalp now. Do this. Do you feel any pain or tenderness when I do this?
No.
Okay, thank you. And I feel that is intact. There are no masses or lesions. And so I'm also going to inspect your hair. I see that it's black, fine, and smooth. And also there is no abnormal hair loss, such as alopecia. And also I'm going to smooth back and look for any lice or pediculi. So I'm going to go around to the back and the nape of the neck and behind the ear. And then I see that there's no lice or nits. And so next, oh yeah, and there's no evidence of microcephaly or hydrocephaly of the head, the shape of the head. And so now I'm going to assess the patient's face. I'm going to test cranial nerve 7 right now. I also see that symmetrically bilaterally too. Symmetrical bilateral, and the skin color is even all throughout. And there are no involuntary movements such as tics, spasms, and I do not see any lesions or masses as well. So can you please raise your eyebrows, wrinkle your forehead, smile with teeth and without teeth, and then frown, and then purse your lips, puff your cheeks out, and then whistle. I see that cranial nerve 7 is intact, and there's also no visible facial asymmetry, such as Bell's palsy. And then now I'm going to assess the ears. I'm going to see that the color is even, and also I'm going to palpate their auricle now. Do you feel any pain or tenderness here?
No.
What about at the tragus?
No.
No? What about the mastoid process?
No.
No? Okay, so I do not feel any nodules or masses or lesions as well. And also I'm going to test cranial nerve 8 right now. Do you think you can please turn around that way and then cover your left ear? I'm going to whisper a word, please repeat it back.
Apple.
Okay, I see that the patient has no hearing loss in either ear, and they're able to successfully do this, so cranial nerve 8 is intact. Now I'm going to do an otoscopic exam in their left ear. So with their left ear, I see that the external canal is pink. There is yellow dry cerumen, and also there are no lesions or any drainage. The tympanic membrane is a pearly gray, and there's a slight concave curvature for it, and there's also a 7 o'clock light reflex on the membrane as well. And so, thank you. So now I'm going to move back to the eyes and the eyebrows. So the eyebrows, the hair is distributed evenly all throughout, no hair loss as well in either eyebrows. The color is also appropriate. And now I'm going to see their eyelashes. I see that they curl upwards, the upper ones, and that they go out. The downward eyelashes go down and out. And so I'm going to pull down and see the patient's conjunctiva. I see that it's pink and moist. The sclera is white. The pupils do not show any evidence of anisocoria. The irises are dark brown, and the cornea is transparent and shiny. And so I also do not see any redness or lesions or any masses as well. And so now I'm going to shine this. I see that the corneal light reflex in both pupils, and it is symmetrical bilaterally, and is in each pupil in both eyes. And so they also constrict briskly to the light. And so I'm going to shine it again, and then shine it each one. And then can you please put your hand in the middle? And then I see that the pupils constrict consensually with the lights. And then let's also, the pupils constrict briskly with the light, and they consensually constrict together. So now I'm going to have you do the accommodation test. I'm going to have you look forward. Do not move your head, and then follow the tip of my pen light. I see that the eyes converge and also the pupils constrict briskly for the pen light. And I'm also going to test cranial nerves 3, 4, and 6 with the 6 cardinal fields of gaze. So please follow my pen light without moving your head. So go up. And I see that there's no evidence of nystagmus, and the patient is able to do these extraocular movements smoothly. And so next, I'm going to be looking at your nose. I see that it sits midline to the face, and the patient's nose is this even color all throughout. And so, can I also have you look up? I see that no septum deviation or polyps, and that there's still no drainage as well. And then I'm going to palpate now. Can you please, do you feel any pain or tenderness?
No.
At the sinuses?
No.
No, and also there's no displacement of the nose as well. And there are no masses or lesions as well. So now I'm going to look at the patient's mouth. I see that the lips are pink and smooth, and also they're moist. And also, can you please open your mouth for me? I'm going to put this tongue blade on your tongue. I'm going to look at your uvula. Can you please say "ah" for me? I see that the patient's uvula retracts, so cranial nerve 10 is intact, and also that the patient's tonsils are visible, and also that they are graded a +1. And so, can you stick your tongue out for me, please? Can you move up and down, side to side? Okay. I see that patient's cranial nerve 12 is intact because the patient has full range of motion of the tongue. So now moving on to the neck and throat, can you please move your head up and down, and then turn it side to side, and then shoulder to shoulder. I see that the patient has full range of motion of their neck. And so can you turn your head towards my hand, please? Thank you. And then shrug your shoulders against my hands. I see that the patient has 5 out of 5 strength of the spinal accessory muscles, and this means that cranial nerve 11 is intact. So I also would like to look at the patient's nails. I see that they are pink, smooth, and rounded. I do not see any evidence of spooning or clubbing. And so I also do a capillary refill, and I see that it refills within 1 second. And then skin turgor test, it is elastic and it briskly returns to the same place. And then I'm going to do radial pulses. I see that the patient's radial pulses are symmetrical bilaterally. They're graded a +2, and that the rate and rhythm is regular, and that the patient has a 74 beats per minute pulse. And respirations here. And I see that the patient does not use any accessory muscles to breathe, and their breaths per minute are 14. So now I'm going to move on to the anterior thorax. I see that there's no evidence of barrel chest, as the ribs angle 45 degrees down in relation to the spine. The AP ratio is also a 2:1, and also the color is all even throughout. And yes. And so I'm actually going to test fine motor coordination right now. Can you please do this? Can you follow your finger to my finger? And then can you do this? And this? The patient is able to do this, and that their cerebellar function is intact, and also they're able to do fine motor coordination successfully. And I'm also going to assess the upper range of motion of your upper extremities. Can you go like this? Can you go like this? Supinate and pronate. And then can you go like this, 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 and out with your fingers? And then do this with your fingers too. This, out, yeah, and then out. Thank you. I see that the patient has full range of motion of their elbows, wrists, and fingers. Now I'm going to assess the strength of them. So can you please use this hand, go like this, and pull, okay, and then push towards me. Okay, thank you. And then can you push against my hands, okay, and then push down. Thank you. And then your fingers, can you go out like this? Can you push against my hands? Thank you. And then squeeze them. Okay, patient exhibits 5 out of 5 strength of their upper extremities, such as their elbows, wrists, and fingers. And so now I'm going to continue on with the lungs. So I'm going to listen to their lungs first. And I'm gonna start with the diaphragm with my stethoscope. Yeah, so there. I'm gonna start at the apex of the lungs from here. Breathe in and out as you feel my stethoscope. And these are the bronchovesicular sounds. I do not hear any adventitious sounds, such as crackles or rhonchi. Moving on to the vesicular portion of the chest. Here. And then go down, last one. And the patient does not use any accessory muscles, and that the rate and rhythm of their breathing is normal or is regular, and there are no adventitious breath sounds in the vesicular regions as well. So now I'm going to move on to their sides. So there's 4 points on the right side and 3 points on the left. I'm going to start here. Breathe in, please. And I'm going to start here. Breathe in, please. Go back a little. Breathe in, please. Okay, breathe in, please. I still do not hear any adventitious breath sounds, such as crackles. The last one on this side. And then the last one on this side. I do not hear any adventitious breath sounds in these vesicular regions. And then can you please turn that way? I'm going to now listen to your back. So I'm still going to start with the apex of the lungs. Yes, thank you. And then just breathe in again. Thank you. And then again. And then I'm going to go to the scapular ridge. Go breathe in, please. Go breathe in. Okay, 2 down. 2 down. This is the vesicular breath sound still. I do not hear any adventitious sounds such as crackles or rhonchi. And here. And then last one. And then thank you. So you can turn back. Now I'm going to listen to their heart. And then I see that there are no visible pulsations. And then I also palpate here. And I palpate down here. And I do not feel any thrills or heaves. And that, yes, that is a good thing. So I'm going to listen to the diaphragm first. I'm going to listen at the aortic valve, at the sternal border, right sternal border, the second intercostal. I hear S2. I hear S2 at the pulmonic valve, and this is at the left sternal border at the second intercostal. At the third, I hear Erb's point, third intercostal, still the left side. I do not hear any heart murmurs. At the tricuspid valve, I hear S1, and this is the fourth intercostal at the sternal border. And then lastly, at the mitral valve, I hear S1, and this is at the midclavicular line at the fifth intercostal. And I'm going to move to the stethoscope and listen for any S3 or S4. So at the aortic, I do not hear any S3. I do not hear any S3 after S2. At the pulmonic, I do not hear any S3 after S2. I still do not hear any murmurs at Erb's point. At the tricuspid, there's no S4 before S1. And then at the mitral, I do not hear any S1 before S4. And I did not hear any pericardial friction rubs or any extra sounds. So now I'm going to have you lay down. I'm going to do an abdominal assessment on you. So first I'm going to inspect the abdomen. I see that it's flat, there's no abdominal distension, and also that there are no venous patterns or venous pulsations around the umbilicus. And so next I'm going to auscultate in one in each quadrant, starting with the right lower. I do not hear any, the diaphragm too. I do not hear any evidence of borborygmi. I hear high-pitched gurgling sounds that are intermittent as well in each quadrant. Yes, yeah, and I heard that. And so now I'm going to percuss. This is going to include 13 points. And I hear, hear tympany all throughout. There's no dullness, so no enlarged organs or any fluid retention in any of the abdominal organs, and that there's no distension as well. I'm going to do light palpation now with 2 fingers. This is 1 to 2 centimeters. Do you feel any pain or tenderness here?
No.
What about here?
No.
What about here?
No.
What about here?
No.
And I'm going to do deep palpations with 4 fingers. Do you feel any, and this is 3 to 4 centimeters too. Do you feel any here?
No.
Any pain here?
No.
Oops. Any pain here?
No.
Any pain here?
No.
Okay, thank you. Can you please sit up for me? And so I'm going to assess the patient's lower extremities now. I see that the hair is evenly distributed all throughout, no abnormal hair loss. And also the skin color is also even all throughout and appropriate with the patient's skin color. So now I'm going to assess the pedal pulses now. So that includes the posterior tibialis pulses. I feel that they are graded +2 and symmetrical bilaterally, and that the rate and rhythm is regular. And then now again, with the dorsalis pedis pulses, I feel that they are symmetrical bilaterally and also rate and rhythm is regular. And it's a grade of a +2. And then capillary refill with the toes, it returns in less than a second or less than 2 seconds. And that, yeah, it is also fine. So now I'm going to assess patellar reflex. Please relax your muscles, and I'm going to hit the patient's thing. And I see that the patient's reflex is graded a +2, and it is present. And I also would like you to tap your, and then move your shin down. Move your heel down your shin, and then also make a figure 8. The patient is able to do these successfully and smoothly without any trouble, and that it is intact. Also, so now I'm going to lower the bed for them, and that before they get up, can you please get up? Do you feel any dizziness or lightheadedness?
No.
No? Okay, so can you close your eyes and balance on your feet? There's no excessive swaying, and the patient can balance properly, and it is successful. Can you open your eyes, hop on, just stand on one leg and balance and then hop on it? Okay, the patient is able to do this smoothly and is balanced, and their balance, their cerebral function and proprioception is intact, and it is working. And so, can I have you, can I assess your spine first? So I see that the patient's spine that has a natural curve to it, and the spine goes from the shoulders all the way to the gluteal cleft. It is at midline as well, and also there is no evidence of scoliosis for now, and that there is still a natural concave. Can you please extend your back like this, and then go side to side, and then twist, and then can you flex down for me, like bend down and touch your toes? And I see that the patient has no evidence of lordosis or kyphosis and scoliosis. And you can come up, and then can you walk from this point to regular, in your regular walk. And the patient's gait is smooth and balanced, and the strength is bilaterally present and equal on each leg. And so can you also do heel to toe walk? And also the patient's arms swing in tandem with their gait smoothly. Okay, thank you so much. You can sit down now. This concludes our head to toe assessment. I'm going to collect all my materials, lower the bed, put the side rails up, and your call light is there. You can lay down if you want to, and I'm going to do hand hygiene again. Thank you so much for your time, and have a good day.